Welcome to BlackUSA.News Morning Show. I'm your host, William Honolulu Jr. Join us as we explore the news and opinions that impact our community. We break down how the major stories have a very personal, local, and racial impact. No topic is off limits, but even if the conversation gets rough, we're always going to keep it real. Greetings and salutations to all of my people out there in internet land. I am William Honolulu Jr., your host of the BlackUSA.News Morning Show. Today we have a very special show, a very serious show today. We're going to be talking about COVID. I have some very personal contact with the virus and some very personal impacts. So talk about that a little later. But let's talk about what happened yesterday. We had a wonderful show yesterday with Marty McNair, co-founder of the Jordan McNair Foundation. Jordan McNair was a football player who died of heat stroke at University of Maryland in 2018. His father took that grief and really focused it into building a foundation that educates athletes and helps them develop and have protection so that they can continue to develop. He has been able to get laws passed in Maryland and in Baltimore City to really help support student athletes, and really has leaned into enhancing the education for student athletes so that they will know their rights. They will understand how to protect themselves and understand why that's important. We don't want our student athletes out there just as what is a fodder for the cannon. Like, they are lives, they are people, they're not just assets and resources. And it's really great that he's taken the opportunity to take his grief and allow us to benefit from it. As a father of kids who played sports throughout, middle school, elementary school, and into high school, not realizing that was an actual thing, like that your kid could just kind of fall down dying, and even in a sport from heat stroke. And then to find out from Marty yesterday, that this happens every year. During the beginning of many sports or the athletic seasons, there are tragedies at the high school and college level of children dying. So it's really great that he's out there really trying to protect our student athletes and help build a better community for them. Monday, we are going to talk to Jabari Natur of Soul Vibers Nation about this event here, the Kuji Chakalia event in, where is this? This is in Baltimore, Maryland at the Garage. Hey, Tampa. This is going to be a 27th. He's going to come in and talk to us about it. But more than anything else, he's going to talk about how, as you know, Kuji Chakalia means self-determination. He's going to talk about how he has been working with communities over the last decade or so to really empower them so that they can determine their own way forward. For example, an example of his engagement in the community is that he recently worked to get a law passed to expand the opportunities for organization or for individuals to become barbers. Which is in many African American communities is one of the entryways to stability and financial gain. In addition to doing that, he also created a program where his mentees and the other people that work in his program, they go out and provide haircuts to homeless and unstably housed individuals, because why wouldn't you want somebody else to feel good? So he's doing a lot of stuff in the community. It's going to be a great opportunity to talk to him on Monday. So make sure that you show up Monday. Big shout out to, excuse me, big shout out. We always highlight businesses here. Today, we're going to highlight the SJS Financial Firm. They can be found at sjsfinancialfirm.com, run by a good friend of the show and good friend of the channel, Sharif Small. Really active brother. If you are looking to get your financial plans done or trying to get your MBE or anything for your business specifically, you should really give this cat a call. Again, visit his website, sjsfinancialfirm.com. Also, since we're talking about finances, Another big shout out to a Little Faith Accounting. Michael Jackson. I always gotta remember not to, say he when I say his name. But Michael Jackson hit from a littlefaithaccounting.com. He does a really great job. And he's another brother who's very committed to the community, very actively engaged. And shout out, he's also a brand new dad. So if you're looking to have a conversation with somebody or get your finances in order, get your books together, give Michael Jackson at a Little Faith Accounting a call. As we've talked about before, we got to tell our own story or nobody else will. So I'm going to do a shameless self-promotion. My company, The Grinding Gang, is doing a free workshop on December 28th, 6 p.m. It's virtual, absolutely free. So I encourage you to visit grindinggang.com, register so we can, and I'll be teaching the class myself. So teach you some things about business. See, what else? Yes. Again, there is a lot of stuff happening in Colorado right now with Mr. Aguilera Moderos, his case where he got 110 years for damage that he caused and accidents that he caused back in 2000. I think it was 2019 or so, 2018, 2019. And by and large, nobody wanted to see him get that sentence. And there's even some question as to whether he was responsible, because the reason the accident occurred in the first place was because the brakes on his truck worked. The brakes on his truck failed. Good morning. The brakes on his truck failed. And so the question is he even responsible, or are the people that own the truck? Now, while that is a conversation that legal scholars and experts and pundits are taking up back and forth, one of the things that I don't think is really getting enough insight is what is happening on the ground with Black businesses in Colorado. How is this impacting them? Because a lot of times, it's funny, in the Black community, we find ourselves in this position where we support a cause that our support is detrimental to us. So, while we may support, and understand, as a community, the injustice of those types of sentences, at the same time, our support also has a negative impact on us. So if there's anybody in Colorado, any small businesses in Colorado that would have an opportunity, want to talk about their experiences during this time, I would love to have that conversation. You can hit me up at info@grindinggang.com, or just leave a comment, and we'll hook up at the end, or we'll hook up after the show. All right, so today's show is about COVID. As of this morning, there were 5,403,754 COVID-related deaths around the world since the beginning of the pandemic. Around the world, 5,400,000. In the United States, it's 834,455. The reality is that most of the people I know have not owned 800,000 of anything at one time themselves. And so sometimes those numbers, they get difficult to kind of grasp and get our minds wrapped around. But let me tell you how it became a lot less about the numbers for me. I used to be the chief of policy and public information for Maryland's Department of Health's infectious disease unit. So during H1N1, I was the person helping organize communication, outreach efforts, just really trying to educate people on prevention and things like that. And so one of the things, when I knew the disease was going to be serious, is that during H1N1, while, I was seeing the impact on a direct basis, my family, my children and my wife at the time, they all contracted H1N1. And I got to see that, and I saw how bad it was. And I was like, wow. And these people on TV, Twitter, and everything like that, this is the early days of Twitter, they were still calm. And I was like, okay, so, I was able to level set off of their calm. But at the beginning of the coronavirus epidemic, they weren't calm anymore. And I realized that this was going to be big. this was going to be problematic. But I understood the gravity, but it wasn't until it hit me that I felt it. Uh, and the way it happened is that my cousin passed away from COVID. Uh, she lived in Montana. She had 5 kids, uh, husband and sisters who love her, and cousins who love her as well. When she died, I went back and looked at the numbers for Montana and started, because I do research, and I was like, okay, so what were the trends? And then I saw the day that she died, and I think there were 51 people who died that day. And it occurred to me that she was now a statistic. She wasn't cricket anymore. She was some number on that day. And it hit me how these large numbers can make us lose sight of the very personal consequences of this disease, of this pandemic. And as we know, it's not like as a community, Black people started off on good health footing to begin with. It's not like we were getting the best care to begin with. It was not like our infant mortality for us wasn't as bad to begin with. Um, so the only thing that this epidemic has done is exposed, only things it's done is expose and exacerbate an already broken system that didn't work well for African Americans. Now, while this channel is the BlackUSA.News, we're not in this by ourselves. I also want to point out what's happening with Native Americans, Alaskan natives, and non-Hispanic persons. The rate for African Americans versus white people for death from COVID is 1.9 times, but for Native Americans is 2.2. Hospitalizations for African Americans is 2.6 times what it is for white people, but hospitalizations for Native Americans are 3.3 times. So while our plight is problematic as Black people, we're trying to help all people. So let's make sure that as we modify the systems to support our communities, let's also recognize that everybody's communities get better. Now, the fact that every time we do it, there's a study that comes out, white people are the baseline, that's going to be a whole other show for a whole other time. But today we're talking about COVID. So one of the things that is happening in Baltimore and actually in the Mid-Atlantic area is that there is a lot of outreach, and there's a lot of organizations who are jumping in and really trying to engage the community and increase outreach efforts and things of that nature. We're the site of Johns Hopkins Hospital, world renowned, and one of the leaders in the fight against COVID. But there's still a lot of misinformation that happens in the Black community. There's always a lot of fear, valid fear, because the medical system has not always treated our community well. But this this is a little bit different, not just because it's happening to us, me personally, but because this disease isn't like the ones we faced before. In Baltimore, one of the organizations that is leading the way is the Baltimore City Branch of the NAACP, which I have the privilege of being one of the officers of, the assistant treasurer. And today we have an opportunity to talk to the president of the Baltimore City Branch, Reverend Kobi Little. Reverend Little has been a great friend of mine and a great friend of the channel, and Donnie Glover and everything for quite a while. I think the Reverend and I have about 30 or so years in, sir.
That's right. Good morning.
Good morning, sir. Good morning. So Reverend Little, tell me a little bit about what's been happening in Baltimore as far as COVID and the outreach efforts that the Baltimore City Branch has been doing.
Well, in January of 2020, we began to share the news reports that we were getting and the public health intelligence that we were getting out of China and other places in the world that were already clearly impacted by the pandemic, by the coronavirus, COVID-19. And I say clearly only to say that they knew what it was and identified it as such. In hindsight, we know that all across the United States, people were already contracting COVID at the beginning of 2020, long before the nationwide shutdowns started to take effect in March. And here in Baltimore, we called on Mayor Jack Young to convene community leaders in the second week of March 2020 to brief everyone, to tell people what was going on and how they could help to keep their communities safe.
Right.
And then from that point, we advocated to make sure that the city's equity and civil rights director was actually a part of the command center and involved in the chain of command for the emergency response. If we are not addressing public health crises and other critical incidents that impact our communities in ways that put the needs of the most vulnerable first, we're going to fail every time.
Right.
And leadership fails us if they fail to have an equity and civil rights officer involved in all of the high-level decision making, so there can be the sensitivities to the needs of traditionally marginalized communities, those people with disabilities,
right,
and other vulnerable populations. And one of the most vulnerable populations in Baltimore and in most urban areas is the population of people in those cities that are experiencing homelessness. And so we have worked with advocates in the homeless community to make sure that people who are experiencing homelessness have PPE, and also lent our voice to make sure that the city was doing everything that it could to provide for people who are experiencing homelessness. And this has both been in terms of direct provision of housing and housing services, and also in terms of advocacy around the recurring eviction cliffs that we experienced over the last 18 months. We know that when people are experiencing homelessness or forced into congregate housing, they are much more likely to be exposed to COVID and to not fare well. So you may recall, Brother Honolulu, that in April of late March or early April of 2020, there was a Baltimore police officer who went through a housing community and was coughing in the direction of residents, either intentionally trying to spread COVID to them or feigning that he was going to give them COVID, the intent to create terror in that community. And we responded immediately and called for that officer's removal from service.
Right.
And saw that happen. But one of the other things that we saw, the incident was videotaped, was that there were folks who lived in that housing community, Black folks who lived in that housing community, who were responding to this behavior from the police officer by saying, well, Black people can't get COVID. That's a white people's disease. So you can cough all you want to. And it was at that moment that we were certain.
So wait, no. We're not just gonna drive past that like that didn't happen. So this is one of the issues right there. Like there's this misinformation, because I remember at first I remember hearing that, because I had friends who jumped on that $37 trip to Puerto Rico on what was it, Southwest. I mean, not even front. I was going to buy a ticket and hold it for a little while, because I figured, because I knew these are the scientists. Like I knew what these scientists were capable of doing. The thing that I underestimated, and I think a lot of us did, is the impact that Donald Trump would have on the misinformation, and it's even in our community, and a lot of our community didn't really bang with Donald Trump like that, but because of so much confusion and chaos, that was poured into the conversation, these things about like, oh, this isn't a Black people's disease started becoming like a testimony.
Right. Absolutely. I mean, one of the greatest global human rights injustices was Donald Trump, not only his failure and abdication to provide leadership at the beginning of the pandemic, but his intentional misleadership. And Black people have yet to recover from that. The United States has yet to recover from that. And frankly, the world has yet to recover from that. You recited some grim statistics about the numbers of people who have died from COVID worldwide and in the United States. Roughly speaking, 20% of the world's 20% of the people who have died from COVID in the world are from the United States. The United States does not represent 20% of the world's population, one.
Nope.
And two, as a developed nation, a scientifically advanced nation, a nation with a robust healthcare delivery system, it is just astounding that there was such a huge failure to respond in a responsible and effective way. So, when we heard sisters and brothers saying that this was not a disease that Black people would be impacted by, we knew that yet again, the mainstream media and government and corporate communication channels had failed our community. And so we began to convene virtual town hall meetings. We began a social media campaign, and we deployed a mobile public health education unit that is designed to take it to the streets, take the message to the streets. And we literally outfitted a 26-foot flatbed truck with banners and a sound system, and went block by block through Baltimore, sharing with people that COVID is very deadly, and that at the moment, the best thing that they could do was stay at home, stay inside, wash their hands frequently, and wear a mask or face covering.
I appreciate the fact that you are real fancy because you have a mobile health education unit. I would say it's a billboard van, but I like the way you talk about it. It's a video billboard. No, it's not a video billboard. It's a mobile public health unit, education unit. But that really did have an impact. I remember I was out. My son and I were out walking one time because he was home from college, and and this was one of our first times going back out after the pandemic. And we had masks on and everything like that. And I was walking down. We were walking around the Lake Montebello, and the mobile public health, the mobile public health education unit was right there. It had local radio personalities were talking, and it sounded like what I would hear on the radio. It wasn't like, hello, thank you, COVID is real, you need to da-da-da. It sounded like a promotion from a party or some kind of convention or something like that. So props on that. I mean, in real life, because you make it sound real fancy, it sounds like a professor on a caravan coming through your neighborhood, but it's not that. It really is culturally appropriate.
Well, the goal was to make sure that we were connecting and communicating with sisters and brothers. And so we have continued to deploy mobile public health education units throughout Baltimore, across the state, and are expanding that outreach to Virginia, West Virginia, and Delaware with the hopes of encouraging people to get vaccinated. We started with explaining what the virus is and how people could stay safe by masking and staying at home and washing their hands. And then we began to talk about contact tracing and testing. And now we are continuing to encourage people to get vaccinated. The reality is that, as you mentioned, our community has been betrayed. Our trust has been betrayed by healthcare providers and by the government many, many times over for as long as we've been in this country. And even at the beginning of the pandemic, we saw that Black people were being turned away, that information was not accessible, that there was questions about whether or not Black people were receiving care appropriate to their level of disease.
Mm-hmm.
And we saw all kinds of equity issues related to the pandemic, from the inequity in public education and how young people were able or not able to access their lessons,
Mm-hmm.
all of the workforce issues. Black and brown communities are disproportionately represented or overrepresented in healthcare and in food service and in
Mm-hmm.
all of the essential worker roles. And so we
Yeah.
saw that there was not appropriate child care available, that there
Mm-hmm.
was not appropriate paid family leave for when a family member was sick or passed away from COVID.
Mm-hmm.
And so, we ratcheted up our advocacy and partnered with a number of our colleague organizations to push for legislation that would address and provide a pandemic safety net.
Okay.
And so now we are still continuing to advocate, but also to partner with government to make sure that the government gets it right. In Maryland, we know that there are still close to 600,000 adults who are not vaccinated.
Right.
And many of them are also on Medicaid.
Mm-hmm.
And so we will be working to encourage our sisters and brothers to get vaccinated, to provide information, to identify and work to eliminate the barriers to accessing the vaccines.
Mm-hmm.
And then also just challenging people to have courageous conversations and to talk about the vaccine resistance, vaccine hesitancy, and
let's talk about that now. Let's talk about that
absolutely.
now.
I mean, so at this point, we're a year in with the vaccine.
Mm-hmm.
We know that the vaccine has, for many people, it has mild side effects,
Mm-hmm.
injection site soreness,
Yep.
fatigue, maybe some symptoms like that people experience for a day, 2 days, 3 days.
Yeah.
And then in rare cases, we know that people have had problems breathing.
Yes.
But on the whole, side by side, we know that the vaccine is safe and it's effective.
Yes.
It is not a panacea. It's not 100% effective, but it is highly effective in preventing infection. It is highly effective in preventing hospitalization, and it's highly effective in preventing death. And we know that when we don't get vaccinated, we expand the breeding grounds for the virus and create space for it to mutate.
Yep.
And when viruses mutate, they are changing to survive.
Yes.
They are changing to prolong their life cycle.
That's all the virus wants to do, is what it's supposed to do.
Exactly.
So let's put this into context, because one of the things that I've realized in talking to people about this H1N1 and now is that we have done such a poor job of teaching science and math to people that they all they know about science or all they know about health is brochure language. They don't listen to all the side effects and stuff like that, and they think everything's a cure. And so what they don't understand is, a lot of times, is that the viruses, the plagues and stuff that we get, like, this virus and these viruses that impact negatively, they're not even supposed to be in humans. These are animal viruses. And so I think Corona is based on cattle. Is that Corona? Whatever animal this is, bat, camel, cattle, whatever. It's when they have it, it's just like when we get a cold, because the virus wants to live. And so what happens is that it gets a cold, it goes away, it comes back, it goes away. But when it skips the species barrier and it goes from them to us, now we're not built like cows or bats. And so when it does its bat thing in us, our bodies are like, oh no, it's time for us to die. We can't handle this. And so that's what happens. And so it's kind of like, and then when we have vaccines are like, It's like giving armor to your white blood cells. You know, like, so those of you all who follow like comic books and stuff like that, you know, in the scale of a hero, they have to go get that MacGuffin. Yeah, they get that thing. Yeah, they get that, or Rambo comes and teaches your troops or whatever, where you have that reflection. That's what the vaccine does. The vaccine is basic. Oh, that's a great one. The vaccine is basically like this super commando dude that was trained in a laboratory. He comes in and trains your white blood cell troops so that when the COVID comes to get you, they're like, oh no, we know how to deal with you. We heard about you, because COVID. The thing is that COVID gets a whole new style. Like your body's immune system, they've been trained for generations. Like, you know, Rambo, John McCain, and all these other people. Well, John McCain would be a really good example. I messed up the metaphor.
McCain.
Yeah, that's my fault. Like Navy SEALs type, but these are like the vaccine has been trained in a laboratory to understand COVID's new thing. But here's the problem: the unvaccinated people, their versions of COVID, these dudes get an opportunity. They don't got those blood cells don't have the new training, so COVID gets to improve its situation. COVID gets an opportunity to like, okay, no, they blocked this way, so next time we come up with this, and now COVID comes to find the blood cells that were trained by, you know, the Navy SEALs vaccine. But now the COVID terrorists have learned new tricks. So even now the Navy SEALs vaccine are still effective, but they're not going to be able to keep COVID out of your body. They'll be able to stop them. They won't be able to kill you. But that's how this works. And the more of us that are vaccinated, the more we got like Navy SEAL trained cells. Like, okay, so maybe I'm not Miss Frizzle on the magic.
We're only as strong as our weakest link. So
yes.
if 10 of us have these trained commandos in our system, but there are 20 of us who don't, then there's a huge gap, and it makes all of us vulnerable. So we have been doing this advocacy, both directly as it relates to the virus and how people can stay safe, but also all of the attendant conditions as well. But we haven't been doing it alone. We have been partnering with community-based organizations, with faith-based organizations, and with institutional partners and government. So
wait. People out there doing good work. You just named the categories of people that's doing good work.
I'm gonna run through it.
We want to shout people out, because if they're really in the community, helping our community, we want to know who they are. They did. I mean, because hell, it's not like a lot of people line up to come help us. So if we got some allies, let them know who our allies are.
Absolutely. So let me start with some of the community-based organizations, great organizations like No Boundaries Coalition, Park Heights Renaissance, Strong City Baltimore, CASA, and many others. We have had a great partnership with Central Baptist Church, with New St. Mark Baptist Church, with Pennsylvania Avenue AME Zion Church, and others, to get the word out, to distribute masks, to hold vaccine clinics. Wonderful community-based organization partners and faith-based organization partners. We've also had strong support from Johns Hopkins University and Medicine. We've partnered with the University of Maryland School of Medicine. We have had good support from Flywheel Digital. We've had good support from Bank of America. We have had a good working relationship with the Morgan State University School of Community Health and Policy, Dean Kim Sidnor there, and working with Philanthropic to get the word out, one of our early sponsors and supporters. So there are lots of partners. We certainly have been proud of the work of Mayor Brandon Scott and Commissioner Letitia DeRaza, and their staff at the health department. They have been culturally competent. They have been responsive, and they keep rising to the occasion. We are in another surge over the last couple of days, really last 10 days. We've seen incredible spikes as a result of Omicron here in Baltimore, but across the country. And so the
Yes.
health department has been trying to keep up with the demand for testing and been distributing testing kits. So our hats off to the Baltimore City Health Department. We've also been working with the Office of Minority Health and Health Disparities at the Maryland Department of Health, deploying mobile public health education units for their campaigns, both in English and in Spanish, targeting the zip codes that are hardest hit and least impact and the hardest hit by the virus and least vaccinated. And as you can imagine, most of those communities are Black communities in Baltimore and in Prince George's County. We're also seeing a lot of vaccine resistance in Western Maryland. And we've been working statewide with partners through the Maryland Health Equity Alliance to advance the message across the state, and also to call for equity in terms of how the government and corporations, health institutions respond. Listen, when we say health equity, we certainly mean equity in terms of delivery of services, but we also mean in terms of the business side. If you are not paying Black and brown people to bring their best ideas to the table to address the pandemic, if you're expecting Black and brown people to give you their best for free, then you are creating and perpetuating inequity.
You're part of the problem.
When you don't pay people and they can't pay their rent and they can't pay for food and they can't pay for medicine, then it creates a problem. So we have been working at the state and local level to make sure that we see the supply chain include Black people and brown people in representative numbers. We've still got a long way to go, but I think the message has gotten across. And so we are happy to have partnerships with the state government and with the city government to move our communities to a safer place. But, I just want to speak. Go ahead. I'm sorry.
No, I wanted to ask you a little bit, because one of the things that you that seems really effective is how it's not just the Baltimore City Branch. It's like you went through, there's a thing a lot of times like, oh, these organizations, they partner with other organizations that are like-minded. Oh, of course we partner with the unions, of course this, but like you name like state agencies, city agencies, religious organizations, community-based organizations, healthcare organizations, educational institutions. Has that, so because, and I know like sometimes it's like herding cats. Has that had an impact on your, or do you think that has had an impact on your ability to engage the community positively or negatively, that larger coalition?
Definitely positively. Listen, since March of 2020, and just as much now as then, we have been in an all hands on deck situation.
Yeah.
As much as people want to move on with life, as much as businesses want to move on with the business of making money, we are in a crisis situation. It has not ended. In fact, if we don't get a hold of it, if we don't get a handle on it right now, it's only going to keep getting worse. And so what we have found is that having public-private community partnerships, right? That's three, not just public-private, but the government, the business community, and community-based organizations working together. It is the way that we can most effectively speak to the needs of our community, educate our community, and move to a safer place. So we have, been very clear that is the model that's most effective. You may recall that at the end of August, we held a press event. We had the mayor, the city council president, a representative of Senator Chris Van Hollen's office, We had our Baltimore City Senate delegation leader, Senator McCray, our House delegation leader, Delegate Smith. We had the head of the Hopkins Health System, Mr. Kevin Sowers. We had representatives of the community-based organizations that I mentioned before. We had Dean Kim Sidnor. We had Dr. Niharika Khanna from the University of Maryland School of Medicine, and others there to say this is the work that we're doing, but not just to say this is the work that we're doing, but to invite representatives from every sector to join us in this campaign to stay safe, to mask up, and to get vaccinated.
Okay. And one of the things that also you've mentioned several times, and I think, and I know that it has, but I want you to talk a little bit more about it, is that you keep talking about the need to have people who are advocates of equity or who are in roles to ensure equity at this table as well. So it sounds like these two things together, the diversity of the coalition, not just racial and ethnic, but also kind of along the continuum of power and institutions and things like that, mixed with this cultural competence, gives us a way to more effectively engage. Does that sound?
That's exactly right. Listen,
okay.
The pandemic disrupted our lives. It disrupted the world as we know it. And that was terrible. But there's also an opportunity for us to disrupt the inequitable, unfair, white supremacist power dynamics that have caused people in our communities to experience the health consequences of white supremacy. And so as we talk about the public health side and the science side of the pandemic, we also have to talk about disrupting unhealthy power dynamics. We have to talk about disrupting unhealthy economic arrangements. And that always has to be a part of the conversation, because if we keep doing things the way that they've been done in the past, then we'll keep getting the results of the past. And so now that we've had this disruption, the opportunity is there for us to reset the table in a way that everyone is represented at the table and that everyone gets their fair share at the table. And so, the advocacy part of this work during the pandemic is an essential part of the program for making it through this period in a healthy way, and then creating a paradigm shift that gives us a new way to relate to each other. So as your elected officials talk about COVID response, somebody should always be asking them, and as you spend money to respond to COVID, how are you taking care of Black businesses and brown businesses and women-owned businesses and businesses run by Indigenous people and people who are differently abled? These important questions, because if you're not thinking about the diversity of the population when it comes to spending money, then you're probably also not thinking about the diversity of the population when it comes to other important issues.
And to the point that you made earlier, a lot of the experience that we have had in healthcare has been a reflection of white supremacy as a tool of larger capitalism. Because let's not get it twisted. Whether it's religious bigotry or whether it's some of these other isms, they tend to all have the same impact, ensuring that the people in power stay in power.
People in power stay in power, and the people who are not in power get exploited and crushed.
Absolutely. But well, see, I just assume that's what capitalism is for. Like, capitalism is designed to be exploitive. The only way you can win capitalism is that you have to, you have to pay people less than their worth and charge people more than what you produce costs. That's how you win capitalism. Jeff Bezos. Or steal some shit. That you can always steal some shit. That's another way to win capitalism. But even when you steal shit, that's still exploitive. And so this health piece reflected. Hopefully, you'll come on again and we can talk more about this equity lens, because like I mentioned in even the statistics, when we talk about this and when we talk about inequality, why are white people the baseline Like, if anything, Native Americans should be the baseline. But if you did that, think about what that says about the mindset. Those are the first people here. So if we're measuring how things are done in the United States, there should always been at least one. They should be at least the baseline. Hell, they should actually have it better than everybody else, but white people.
Well, we're clear.
White supremacy.
Right. We're clear that the baseline ought to be the most vulnerable amongst us.
Oh, okay.
All policy ought to be made with the most vulnerable in mind first. And if you start with the most vulnerable, then no one is going to get left behind. But if you start with the most powerful, if you start with the wealthiest, if you start with the most affluent, then by the time you get to the most vulnerable, we've already been left behind. So,
there's not even the remaining time left.
Right. In the remaining time that we have, I did want to speak directly to the issue of vaccine hesitancy and resistance. We started earlier.
Okay.
We started earlier talking about the misinformation in our community. We've touched on the injustice that our community has experienced that has caused a betrayal of trust. And hands down, we've been victimized.
Yes.
But we are more than victims.
Yes.
And Black people have a responsibility. We have a responsibility to ourselves, to our ancestors, and to our yet unborn generations to protect ourselves. And so we need to be having some real conversations in-house about the misinformation and about how the misinformation does not serve our communities. We need to have some really hard conversations about the reality of the world that we live in. We don't live in a perfect world, so we have to make hard choices. The vaccines are not perfect, but we have to make the hard choice to adopt the vaccine because they are the best shot that we have. The risks of the vaccine are virtually non-existent in comparison to the risks of contracting COVID-19. And we need to have that kind of pragmatic clarity. We need to be speaking that truth in our own house because it's kind of empty if you call other people outside the house to task if we're not also being accountable inside the house. And so if we love Black people, and I challenge all of us to love us because we're wonderful people.
Yes.
If we love Black people, then we've got to come up with solutions that keep our community safe.
Yes.
And just sticking our head in the sand and saying that's the white people's vaccine or the vaccine is going to do X, Y, and Z to you is not going to keep us safe. And so we've got to really have these hard conversations to challenge people to stop the misinformation.
So let me challenge you on part of that. I absolutely agree that we have to give them good information. I've had an opportunity to talk to some people who have been very clear that they're not going to get vaccinated. And one of them, I had a really great opportunity because I'm like, I don't want to convince you. So she's one of my mentees. I'm not trying to convince you. I just want to understand. And I don't normally get an opportunity to have these types of conversations. So I went with her. Everything that she said is like, well, let me give you some information. Does this change your opinion? And we got through all of the things, all of it. And we got to the end. She said, well, you know what? You've given me some new information. I have to do some research. And I was like, oh, wait, no. You know who I am. I can give you these citations of the things that I'm talking about. Tell me what other piece of information can you find or that you're looking, because I'll get it for you that will help make the difference. She said, probably nothing. I'm afraid, and I don't think it's helpful. And so, like the Dunning-Kruger effect, people who don't know enough, they get stuck in it and they believe they know everything. So how do we get past that? Because that's not what you're talking about. I really think that those people, that's not going to be, let's get you good information and you'll make good decisions. I mean, think about, we're talking about the same, I am a diabetic and I'm going to have a cookie today. I guarantee you that's going to happen. And it's not because I am not cognitively aware that, and by the way, I'm going to have them in excess. So it's not even like I'm going to do moderation. And it's not like I'm not cognitively aware I need to avoid that behavior, but they make me feel good, damn it. And it's Christmas. So I'm going to have a damn cookie. That's not rational. You're not going to be, I know that I should not do it. But as clear as I'm talking to you today, now that I've said it out loud and I put myself on blast, and I'm probably going to get some comments, I might not do it, or I'll just lie about doing it. But still, that's a very real thing. And when we're talking about the vaccine,
but you make the excellent point that having the conversation creates opportunities for reflection and changes in behavior. Yeah. We're not trying to convince anybody. Right. We are trying to encourage people, and we are trying to rebut harmful information. Okay. And so even though I may not change the mind of the people who are intentionally spewing misinformation, like I saw painted on the Maryland Avenue Bridge over there by Penn Station yesterday, I saw spray painted on there, Omicron is the common cold. That is intentional misinformation. Yeah. And so we will rebut that so that the people who are in the intended audience of that misinformation are equipped with the tools that they have to see that for the falsehood that it is. Okay. At the end of the day, we do have to keep having these conversations. We do have to keep asking people, what are you going to do to address the problem? Because, and you described that dynamic so effectively. Your mentee wanted to punt the ball. After you all had this powerful conversation, she still wanted to kick the ball down the road some by saying, I got to do some more information. But at some point, we have to have some firm decision points. And hopefully, well, this explosion of COVID Omicron will be the impetus for some people to reach that decision point and say, okay, it has been a year that this vaccine has been available. I do see the positive impact of it. I do recognize that it's not a panacea. We'll probably have to get a booster shot, but that's better than getting COVID, clogging up the hospital, dealing with all of the respiratory issues and the long-term issues, and also taking up space in the hospital that people who have other health issues need.
Yeah, because don't forget, people still have heart attacks. And it's so funny, not funny, but we've gotten so caught into the COVID portion of hospitalization that we don't realize the implication that it has had on our entire healthcare system. So guess what? That procedure that I did not have done because of the COVID restrictions, well, that condition didn't go away. My body didn't COVID restrictions. You know what? Cancer, we just gonna chill a little bit. No, the problems in our body still kept on, and even in our communities. Let's not pretend that Black people had a really good experience going to the doctor on a regular basis when there was no excuse. So to move to a place where now I have a good excuse, how much time is it going to take for us to get over that by itself? So that's a wonderful point, that even when we're looking at the vaccine and trying to, death is not one of the worst things that could happen with COVID for some of us, because the pulmonary disease, people had lungs removed, and even worse for, I remember this one story early on. This woman and her husband were about to celebrate their 40th wedding anniversary. No, they had just celebrated the 40th wedding anniversary, and she had to bury him and her son within a week of each other. And they were very active in their church. And because she had been living with people, she didn't have COVID, but she couldn't even mourn with her fellow parishioners. All right. That is one of those consequences of COVID.
Right. Yeah. I think it's important for us. I talked a little bit earlier about how we have to be accountable in the house. Mm-hmm. There are some serious integrity issues related to COVID, and some questions about whether or not we are going to be selfish and self-righteous, or whether or not we're going to be mindful of the impact that we can have on others. If we are not vaccinated, if we are not practicing the protective guidelines, if we are not getting tested when we know that we may have been exposed, then we are creating the dynamics for other people to get infected.
Right.
And so this is not just about what we want or what we believe or what's good for us, but we have to take into consideration what's good for our entire community. You know, I need to respond. There's a comment in the comments, the online comments about Strong City Baltimore.
Oh, yeah.
Strong City Baltimore is a credible organization. Strong City Baltimore is now a Black-led organization. The chairman of the board is Black, and the CEO is Black. Things that happened a couple of years ago under different leadership were terrible, and it was just another example of the exploitation of our community.
Yeah.
But the leadership there, Reggie Davis is the CEO, and Anwar Young is the chairman of the board, and they have done a great job of getting the books in order there, clean audits. During the entirety of this pandemic, they have continued to provide services at the club at Collington Square, where many of those young people have been impacted by the homicidal violence that plagues our community. They have provided support, counseling, and intervention. The organization, during the course of the pandemic, has continued to provide GED services so that people who have not gotten their high school diploma can improve their skill sets and become more competitive in the workforce. So I want us as Black people to be good and kind to Black people. And when there's a shift that happens, we ought to recognize this shift and then support the shift. If we continue to carry a narrative about Strong City that is dated, that's inaccurate, that's not true, then we're doing the work of those people who don't want to see Black people survive, who don't want to see Black people succeed. And I can tell you from personal experience, I know what Strong City has done in partnership with the NAACP to strengthen our community during this pandemic. So let us be circumspect. Let us remember that COINTELPRO, the counterintelligence program that was designed to disrupt and to defeat Black organizations and Black leadership, let us recognize that is a model that persists and continues to be used against our people. And those people who would like to disrupt and destroy Black organizations and Black leadership, they don't need our help. So let's not help them.
So, and what I want to add to the conversation about Strong City, and this is about the time where I was going to address that, because I try to deal with the comments at the end. One of the things that is happening with Strong City is the opposite that happens with a lot of these white organizations. Facebook is changing its name to Meta, not changing its business practices, but just changing the clothes it wears. Because again, that white supremacist capitalist mentality is really about like, what can we convince people of? Not can we get good, is can we convince people that we are good? Strong City isn't doing that. Strong City, they had problems, absolutely. But what has happened is that rather than just change the name and walk away from those problems, they fixed the problems and and they are growing the organization. Are they where they need to be? No. But they, one, are damn sure better than they were, and they are headed in a direction, and they're focusing in, again, on their core business. They're focusing in on the GED programs, on the community engagements, kind of where they started from, getting back to that core business and not into the sexy organization. What is it? Not subcontractor, geez. Fiscal agency and stuff like that. Now, here's the thing. Smoke and mirrors. Oh, all right. What's up, Art? Smoke and mirrors. He's right. But that's one of the challenges with being Black people, because we start with substance. We're not just going to somebody. We don't even know each other's real name most times. So like, this is the style. Those names don't really mean anything. But Strong City has changed, has worked on the substance of things. So We are at the end of our show. This always happens to me. I get excited talking to my guests. We get on a good subject, and then I got to invite you to be back on. Well, I'm gonna have you on again. I got 30 years in. I can just tell you to come on. Brother
Well,
Little, thank you very much. You want any closing words to the people?
I'm grateful to you, Attorney Honolulu, for inviting me on the show. I'm certainly willing to come back whenever you extend the invitation. But we have a great team of leaders, so I hope that you'll elevate those voices too. I appreciate you for grinding the way that you grind to build Black businesses and to build our community. So thank you, and my hat off to you and to Donnie Glover for the wonderful collaboration that you all have going on now.
All right, thanks a lot, brother. Have a good one, ladies and gentlemen, Internet land, Reverend Kobi Little. All right, ladies and gentlemen, we have come to the end of another great show. Thank you for your time and talented in your participation in the show. Coming to you again from the Grinding Gang Studios in Northeast Baltimore. This has been the BlackUSA.News Morning Show. We are going to see you all bright and early. Well, not bright and early, 10 a.m. on Monday to talk to Jabari Natur about Kuji Chakalia. All right. Have a great one.